I like that I get to help create a documentation system that is more functional and useful for physical therapists, because a lot of the documentation systems now just not user-friendly. There's some documentation that forces you into saying certain things when it doesn't really describe the issue. Some of it just is hard to work, doesn't make sense, hard to understand.
The reason this project is important is because physical therapists these days need a system that's very efficient. Sometimes documentation can be very tedious and there's a lot to do, and we have a lot of patients to see during a day. We're pressed for time a lot of the time, so we want to maximize our time with the patients that we do have and still complete all the necessary documentation.
There's really an issue with making sure your documentation tells exactly what a patient is doing, their deficits, and what they need in the future to help gain their independence to get back to where they were. If documentation doesn't do that, the patient's not going to get the care that they need. It can help in the sense that it can allow the therapists who are writing the notes on patients to be very descriptive, to tell what the patients are doing, basically to paint a picture for the insurance companies. If you're not able to paint a picture for them, it's really hard for someone who doesn't understand what they're doing to agree to continue treatment for them.